AAA stands for three words: abdominal aortic aneurysm. Abdominal because it's a condition that affects the tummy or the abdomen. The second A is for aortic, which is the aorta is the main blood vessel in the abdomen. And aneurysm, the third A, is a condition of dilatation or enlargement of that blood vessel. It's actually very common in males, 7 times more common in males than in females, and approximately 4 out of every 100 men aged 65 will have an aneurysm at some time in their life. As you get older, the chance of developing the condition increases. It really is very important to know if you have an abdominal aortic aneurysm or AAA. If you have a large AAA which may require treatment, planned treatment with some form of operation is extremely successful. The results are very good, whereas if you have a AAA or are unaware of the condition and it ruptures, the results are very poor. Quite often patients don't make it to hospital in time and the surgery is particularly difficult. So it's much better to be made aware that you have an aneurysm and that we can look after you appropriately. The scan is an ultrasound scan. It's performed by a trained technologist who will bring you into a room. You lie down on an examination couch and all you have to do is expose your abdomen. You can keep your trousers on and just unbutton your shirt. It's entirely painless. She'll apply an ultrasound gel to your abdomen and then use a little scanner about the size of a microphone to examine the inside of your abdomen, just looking for an aortic aneurysm. The technologist will tell you there and then what the results of the scan are, and she will supply your GP with a follow-up letter full of all that information. Provided men are registered with the GP and the information registered with the GP is up to date and accurate, they will receive an invitation in their 65th year. If you're over 65 and male, you should really consider self-referral. That is, you should contact the screening office yourself and ask for an appointment. If you have any concerns, you can discuss the matter with your GP before contacting the office. The screening will take place at a location hopefully close to your home. We have established 19 screening centres throughout Northern Ireland. Some are attached to GP surgeries, some are in community hospitals. But the screening office will be able to tell you the one that's nearest to you, and that's the one you should be invited to attend. It really is a totally painless procedure. It's very quick, and it's a very efficient way to decide if you have an aneurysm. The problem with the condition of AAA is that most patients are unaware that they have the condition. There are no symptoms until the aneurysm gets very large and can rupture, and then, unfortunately, it can be too late. Uptake to date has been excellent, with about 4 out of 5 men taking up the invitation and coming for a scan. But we'd really like to see as many men as possible taking up this invitation. The more men take up this invitation, the more lives we can save. When you go for a scan, the result will either be one, it's a normal scan and you can be discharged. In other words, your aorta is of a normal size. If your aorta is slightly enlarged, that is a small or medium aneurysm, then we simply follow that aneurysm up with further scans. If the aneurysm is sufficiently large, then you get referred to a surgeon for a discussion about possible treatment. The benefits of the screening program are really very clear-cut. If we can detect an aneurysm in you at an early stage, we can monitor it and the results of intervention are really good. Whereas if you don't know you have an aneurysm, it becomes large and ruptures, the results are extremely poor. So we have no doubt that this screening program saves lives.